Thank you, Michael. No pressure. No, I would actually emphasise at the start by saying that, yes, LGA published a report out at the LGA conference in July on demand management, which I helped to author, and I also do work with an organisation called ICT Networks, which is a knowledge networking organisation. We've run several events around demand management, including one with the LGA last week. But what I'd emphasise at this stage is that I'm just trying to impart and reflect some of the stories and examples that I've heard, try to put some bones on the concept of, some meat on the concept of demand management, and impart some of the examples. So I'd also be interested to hear any stories or feedback or input from yourselves, because this is an emergent, nascent field. So the more sharing that occurs, the better. Everyone's aware of the graph of doom, or the jaws of death, or whatever people refer to it as, and I think Simon's done a really good job in summarising the financial outlook. Suffice to say that I have heard discussions that have talked about the medium-term risk of financial meltdown, and I've heard of some people expecting as many as 50 local authorities to potentially go bankrupt between 2015 and 2017. So there's also a great slide in Simon's presentation depicting the relationship between supply side transformation and demand side transformation, which suffice to say that, to echo Catherine's point that she made earlier, she hasn't heard anybody who thinks that efficiency and supply side efficiency will be enough to bridge the gap. I'm also very aware that we are under a bit of time pressure. So, and I think Simon's presentation covers a lot of my earlier slides. So, broadly speaking, I should also emphasise that the LGA are currently working on a project with RSA, looking at demand management. We're producing some publications in January, I understand. And this is derived from a presentation I've seen from Ben Lucas, who's leading that work. Broadly speaking, there's two scenarios. There's the idea that there's managed decline, reducing the scope and role of local authorities to the point of being provider of last resort. And the other side of that, the demand side, transformation side of that, is much more in terms of looking at the resources and the skills and the capabilities that citizens and communities can bring to fill their own needs, and reshaping the relationships between citizens, communities and services, and engaging the role that local authorities can play, and engaging partners and in communities in changing expectations and changing behaviours and changing roles. And it's possible that the future actually will have both a degree of retrenchment but also a degree of co-production. And a lot of the following slides do emphasise the importance of co-production. And one of the conclusions I would say from thinking so far is that demand management sounds quite sort of an efficiency term. It was 1972 and it's something technical. It's actually all about people. It's all about engaging people, reaching people, understanding their needs, and it all hinges on trust. So that's the sort of skill set. And it's also interesting because historically, if you ask frontline staff why they go into public services, they will tell you that they go into public services to make a difference. And they see their role as serving the public as being to do things for customers. And that's a fundamental shift. Demand management will require people to help people by helping them help themselves. And that's a major, major shift in thinking. So what do we mean by demand? Some of these terms appeared on Simon's slide earlier. Just to run through some of these things, excess demand. Ben Lucas recalls a story he's heard of council workers visiting an old lady who's had some adaptations put into her house to help her remain independent and stay in her own home. And one of them was a stair lift. And the person who was speaking to her said, how have you found the stair lift? Oh, well, it was installed really quickly, and it turned up on time. They were very polite, and they've done a great job. And he said, well, how are you finding it? He goes, oh, I never use it. I don't need it. So it's an interesting example of there's been an assessment process that's gone in there, and they've ticked the box and they've installed that. And so that would be regarded as excess demand. Dependent demand, Michael Coughlin recalled the story of a chief executive who said that if local authorities had a service that offered a nose blowing service, there would be queues around the corner. So failure demand, that's a fairly well established term. If you look at housing repairs and demand that arises partly as a result of how the system behaves, and there's the idea, we did some work with Suffolk, and they said that by the time the customer makes a complaint, it's already cost the council hundreds of pounds in terms of the repeated contact and repeated escalation of a service request. There's preventable demand, and the fire brigade have been very successful in their work engaging people and doing fire safety checks and installing smoke alarms to the point where they've reloaded the number of domestic house fires. And that's an interesting point in terms of the timing of engagement with members of the public, insofar as a significant portion of demand for public services arises in response to events. It's a reaction to a crisis, such as an honourable person falling at home, etc. And the provision of service, the decisions, the dialogue around what services to provide are often made in that moment of crisis. So a large part of demand management practices that we've seen thus far focus on early intervention and prevention, so that decision making takes place in different context. There's also avoidable demand, and I apologise for being the author of the NI14 guidance many years ago, but that hasn't gone away. I heard an interesting story from Wigan. They had a director do a mystery shopping exercise, and he played the role of an unemployed person seeking help from local service providers, and he began by visiting the job centre and asking for advice on housing benefit. They directed him back to the housing benefit office. He then had another inquiry, and they directed him back to the job centre, and then he ended up in a third location, council office, to talk about council tax benefits. He had to explain himself 4 times in 3 different locations, and it took him 3 hours. So that, as well as creating costs for the customer, that creates huge amount of costs for frontline public services. A further distinction is demand that costs the public sector money and demand that contributes. For instance, we want more volunteers, we want more foster parents. So just differentiate between those two. And the other thing is, to summarise this discussion around what is managing demand, is the idea that we already implicitly influence demand one way or the other, whether we do it by accident or by design. Because if you focus on efficiencies in any particular individual service, or you reduce or ration provision of service in any particular place, it's possible, probable, that demand will just emerge, it will become a false economy, it will pop up elsewhere. So just to be aware of that. Generally, in terms of how do we manage demand, and these 4 areas fall on some of the work that's empowered, this is the early work that empowered it around putting some definition around this space. The first thing in any demand management exercise is to get a better understanding of customer need. And that could be data, that could be around socio-economic data, it could be through customer journey mapping, but it can also be through social and ethnographic research, collecting, generating stories of customers and communities and how they experience services. So it's quite encouraging to hear Steve mention social anthropology this morning. There's also the issue of diverting demand, and there's the example I gave of the mystery shopping exercise in Wigan. But also there was a project in Lewisham looking at offender management a couple of years ago, and they found that there were 16 different assessments somebody who was recently released from prison had to go through. And when they asked the person what they thought about it, they said, well, I just thought it was part of the continuing punishment for having offended. Now that's slightly amusing, but it costs all of those organisations a lot of money to collect that information, to ask the offender the same questions over and over again. It also alienates them. It's possible that they won't want to engage with public services again, and the longer term consequences of doing that could be quite substantial in terms of the effects of crime on society and the costs of the criminal justice system. There's preventing demand, which is early intervention, we'll talk about that a bit more, and there's the issue of cultivating resilience, and we'll talk about independence and self-reliance and self-sufficiency or sustainability. And I suppose the shift there is a question of a shift in perspective from talking about how do we meet demand, how does the public sector meet demand, to identifying and understanding and articulating what that demand is with the customer, and then asking how is that need best met, how is that need fulfilled, rather than starting with an assumption that we'll have a role in it. And just to further unpack demand in this, there's the opportunity to do it at an individual, community or service level. So, there's lots and lots of examples, and the LGA report gives a lot more detail than I'm able to cover in this particular presentation about some of the work that is already going on out there. I'm taking a leaf from Catherine's book and talking about asset-based developments insofar as some of the capacities the sector already has. There's a lot of examples of people very effectively identifying needs. This is not an exhaustive list or an exclusive list, and I'm very interested in hearing other examples. But perhaps if I could focus on two aspects. One is many of the most successful examples of demand management have taken a holistic view of any system and a holistic view of people's lives and tried to understand how the system works from the customer's perspective. And there's one story from Suffolk which I thought was very interesting insofar as they've got a range of different service providers around young people services, children and young people services into a room, and they had an ex-customer, ex-client of theirs present what it was like to experience services. And they recalled the story of, I asked, well, why didn't you leave home to go on to college when you had an opportunity to do that? And she said, well, nobody seemed to realise, none of the service providers understood that if I had left home then, my mother's state wasn't entirely right, so my younger brother, who was still a minor, would have probably, or was likely, ended up back in care. And none of the service providers that were involved in this particular family could see that. So it's interesting that we expect the customer to join the dots. So the other thing is, I would say, around cultivating social capital, and that comes back to my point about starting with the customer experience and asking what can the community, rather than what is the need, what can the community already do for itself. So just to give you a very brief, how do we time with your phones, understanding drivers, customer journey mapping. This is an example of some work Birmingham did to understand the life of a long-term drug user. It goes all the way back to 1991, and what's interesting about this is the pathology and the trajectory that they're on. It's also interesting to see the interplay between different factors. So you've got depression here, you've got domestic abuse, you've got suicide, you've got arrest. It's also interesting to see along the bottom the amount of contact that you already had with the state, and all those opportunities potentially those actors had to change things, but also the immense cost involved in that. So this is one of the techniques and tools that's being used to understand what is driving people's behaviours. This is also a depiction of the range of different agencies that were involved in one way or the other. And we all know from the stories that the issue is the degree to which they could share information, collaborate and join up operations around people. Other work, and a lot of this, some of these examples call on the customer-led transformation programme, which ran for 4 years and was funded by CLG and the LGA. But there's good examples of how, if you're going to, if preventative demand management is going to have an impact, well, how do you do that before there's a problem? How do you do that proactively? How do you identify needs in the absence of a problem? And one example is the circle of need methodology, which seeks to identify the range of different needs that a person might have. In this case, it was older people living in poor quality stock housing. This was some work that Shorty did around fuel poverty to understand the relationships between one need and the other. And of course, fuel poverty is a good example insofar as in order to heat their homes, older people will, for instance, run the gas on their hob, which is an inefficient use of gas. It's expensive, it's also highly risky insofar as causing personal injury or domestic fires. The solution to that is better insulation, etc. There's also the example that Lancashire did around trying to understand the needs of vulnerable older people and looking at the list of people who are using the assisted bin collection scheme and taking that as a proxy that if they're using this because they can't take their bin from their yard, their front yard, what other needs may they have? They clearly have mobility issues, they may have disability, they may have physical incapacity. So what other needs may they have? And they were doing this because, I mean, the range of potential scenarios they were trying to avoid includes injuries from falls, domestic fires, hospitalisations, declining mental and physical health due to a lack of access to health centres. And they estimate that the cost of residential care is, this was a few years ago, £13,000. So anything you can do to prevent people needing that to support their independence can have a huge impact. This, again, is about integrated disciplines. It's a range of different bodies that are involved in offender management. This eventually led to the Bedfordshire piloting a new integrated model, which took a cohort of young offenders and integrated the key people that they were needing to work with, streamlining that process. So rather than have a huge amount of duplication and no coherence, and had integrated teams, they were very successful. They reduced the number of offended, 20% reduction in the numbers of the cohort offending, 37% reduction in the number of offences, and they estimated using Home Office figures that if you annualise this in that particular area using this method, they would have saved around £1.5 million. These are mostly costs to society, though. Josh talked about risk earlier and how we need a more mature approach to addressing risk, perhaps a more appropriate or proportional approach to addressing risk. And this is an example of some work that Suffolk did to transform children and human services. And anybody who's been involved in that space probably recognises this particular dashboard. But the idea is to try to better manage the stock of work in the system and the flow of work in the system, to move it from the expensive specialist services down towards universal services. And they found two things, that they reorientated the way that people manage cases, the division of labour, the roles, the definition of the handovers. A lot of these changes were behavioural, but they were trying to make people working in the system trust other parts of the system so that they could step down the management of these cases from specialist services through integrated or targeted services towards more cost-effective universal services. So it was a question of a more proportionate approach to risk. For instance, they had a huge volume of open but inactive child in need cases, which they were reluctant to close because they didn't trust other parts of the system to appropriately monitor or oversee those cases. So they kept them open. That kept a huge amount of cost within the system. And it actually wasn't really managing the risk. It was managing the risk from a sort of an audit or hierarchical perspective, but not actually from the case perspective. So 2 minutes, right, okay. Makes a similar point about working collaboratively, and any of the work that you've seen around troubled families will emphasise that. This is a slide about re-enabling. I should emphasise that this is all summarised in the 4 points by the LGA. If you're interested in a copy, I can send it over to you. This is about incentivising providers of care for older people to focus on outcomes which re-enable people, and then monitoring that, because unfortunately, like I said earlier, they often make a decision about how they get the level of care and the investments in that person's care at the beginning of the case, when they're most in crisis, when they most need support, and then they don't revise things. So things stay that way. Gift gaff, there was some talk earlier on about peer-to-peer support and how people can help each other. This is a good example, which I have borrowed from Catherine, that talks about how gift gaff basically incentivises other customers to provide customer service, so it's peer-to-peer customer service. Again, this is a question of tapping into people's sense of community. I'll skip over that one. This point is about the complexity, some of the external factors that influence demand, and how, the one point I'd like to take away from this is the way that people see the world and the way that they interact with the community and with the physical environment and with their communities is not the way that services are currently architected. They're very siloed, stovepipe. So critical success factors, I would say getting the outside view of the world, understanding people's drivers, looking for opportunities to manage demand as part of your overall approach. This isn't new, although this may go to centre stage. Get beyond the presenting problem, take the long-term view. It's all about trust, it's all about people, it's all about changing behaviour. There is an opportunity in joining up the data, both at the strategic and operational level, in understanding all that and encouraging integrated and collaborative work among the front line, But there is, most of this is behavioural, and you would be encourage people to also engage in ethnographic and social and anthropological driven research to understand what makes communities tick. And the last point I'd make is around time, and that's the first point that Simon made in terms of the clock speed and how much we have to achieve in the time frames. And these are just some ideas that I had around the role, potential role of the ICT professional in facilitating this. Sharing data, sharing information between organisations, generating intelligence and insight, enabling single view of the citizen. I've been around this space for a while, so I know what that means. Supporting collaborative working and engaging citizens and communities in dialogue. There are opportunities for information and communication professionals to be heavily involved with just like that. Thank you.